Hello, welcome to our podcast, Nurse to Nurse, Bedside to Breakthrough. My name is Elizabeth Govero, and I serve as the Chief Nursing Officer at Cleveland Clinic Abu Dhabi Hospital. I am very excited for today's podcast. I am joined by Joanne Bruton, who is our Executive Director of Perioperative Procedural Surgical Services and Ambulatory, and Alia Alhaddad, our Nurse Manager of Endoscopy. We will be focusing on Alia today and her nursing journey from bedside to nurse manager, as well as being a United Arab Emirates nurse here at Cleveland Clinic Abu Dhabi Hospital. I'm going to turn it over to Joanne so she can further introduce herself, and we can start our discussion with Alia.
Hello everybody. Yes, Joanne's my name. I've been here since 2016. I was very fortunate to join Cleveland Clinic Abu Dhabi after just 9 months of opening. It's been an incredible experience, and one of the highlights has been getting to meet and work with Alia. So let's get right into it, and if we can ask you, Alia, tell us a little bit about yourself and what it is that you do here at Cleveland Clinic Abu Dhabi.
Yeah, let me start with, thank you for having me here. I'm very excited to share my journey with all of you. So I'm an Emirati nurse with 12 years of experience. I started my nursing journey in Dubai as a staff nurse in medical surgical unit. I was right at the bedside, doing everything to take care of the patients, listening to the patients, communicating, being advocate, and it really helped me to understand the true meaning of compassion and dedication. Then I decided to level up, and I pursued my master's in public health. And let me tell you this, I used to work for 12-hour shift, and my classes starts at 7 p.m. And I was allowed to leave early from work and give my assignments to other nurses. But I decided not to disturb any nurses with my patients, so I took all the weekends shift and night shift in the weekends so that I can dedicate the weekdays for studying my master's.
So you were one of the more popular nurses. They were probably very excited about you taking that on.
Yes,
for them.
They loved me. They loved me at that time. They loved me. They loved me at that time. We have built that relationship together. And after my time in a medical surgical unit, I moved to daycare surgery and orthopedic unit as a nurse manager. And it was challenging working in two different pace. One was very slow pace, one was a quick pace, and leading the team through these two different settings. But again, I can say that it was a very learning opportunity for me as a manager in the beginning. And here comes the turning point when I moved to Cleveland Clinic Abu Dhabi as assistant nurse manager in endoscopy unit. Working in a world-class healthcare facility, high volume of patients, busy unit, cutting-edge technology, and leading the team through the pandemic at that time. It was a very exciting journey, to be honest. And then I earned the manager role in endoscopy unit, and management itself comes with its own set of challenges, but I'm very proud of all the accomplishment we have done together with the team. And also recently I have graduated with master's in nursing, specifically in clinical leadership. So this is actually my journey, and I do other things outside work that keeps me balanced, such as I love reading and listening to the podcast. It helps me relax. Writing is another passion of mine. It helps me reflect a lot. And I am also a social media influencer, and I promote nursing in the UAE.
So that leads me to ask you, it's interesting to hear what attracted you to nursing, because the UAE, it's a developing qualification 12 years ago. What was the attraction to nursing?
So to be honest, nursing was not my only decision. It was deeply rooted into my father's vision for me. He saw something in me. He always felt that I can be a good nurse. Later on, I realized that it's my own aspiration. I always felt that I possess qualities that makes me a better fit for nursing, such as empathy, compassion, courage, and the ability to bring positive impact to people's life. Um, and yeah, that's actually when I became the nurse.
You definitely, I think, role model here at within the Nursing Institute that compassion and that positivity. And you shared with us about writing, so I would love to hear about your being an author of 2 books, and then just how you go about influencing nursing as a profession here in the UAE.
Yeah, so I can say that when I moved to Abu Dhabi, working in this place, especially in Cleveland Clinic Abu Dhabi, made me realize that I used to have passion for writing, and I always wanted to share my story of positive things that I have learned through my journey in nursing, and I wanted to show the real picture to people about nursing, because there was a lot of misconceptions happening, and that's not the true picture of nursing. Through my writing, I have actually showed people, led people through what nursing is. And my advice for nursing out there is that don't afraid to take the leap. Every day in nursing, every day as a nurse, you you can bring changes to people's life. It is challenging, but the impact is worthwhile.
Mm-hmm. It's perfectly said. Couldn't have said that any better.
Very inspiring. It's lovely to come across a leader like yourself that is so passionate and is willing to share that passion with others. Can you describe a little bit about your leadership journey and maybe talk a little bit more about what your leadership beliefs are?
Okay, I can share my secret recipe in leadership.
Always ready for secrets.
Yeah.
Secret recipe.
Secret recipe from Cleveland Clinic, I can say. So there are actually 4 things that I can say that made me a successful leader. One of them is the opportunities that I've got when I came to Cleveland Clinic, from education, leadership sessions, support to go for certification, master degree. These things actually helped me to grow. And then second, I can say that the cultural competence is working actually in a place like Abu Dhabi, which is very diverse, helped me to, and why I say that is, I was able to understand also the values and culture of UAE, helped me to deeply connect with the patients, physicians, and the community in the Cleveland Clinic Abu Dhabi. Third thing is the strength in the character. As a leader, we have to make sometimes very tough decision. And I remember coming to my directors for asking them, what do they do if they face this kind of situation, and listening to different opinion, different perspectives helped me a lot actually to understand and make these kind of decisions. If I'm talking about the strength of character, mentorship comes. It's a secret weapon for me. Having my director Mary and having Joanna as well, as my mentor, helped me a lot actually they actually inspired me, helped me to grow, and gave me the confidence to navigate into leadership experience effectively.
I would second. Mary and Joanne are excellent nurse leaders here at Cleveland Clinic Abu Dhabi Hospital. Do you have, I think one of the big things for nurses is, different situations that we go through, and there's always a situation or a story or something that we can share that has impacted us with others. Is there a story or an event that you want to share that impacted you, either as a nurse or a leader, that would be something you would want others to know about?
Yeah, so I can say that when in the beginning, when I came to Cleveland Clinic Abu Dhabi, I remember there was a patient who had a procedure, but then she wasn't very satisfied. And then when I went inside the room to see what's happening to this patient, the first look, the patient was wearing burqa, the Emirati cultural face cover. And I wanted to hear her story, what was upsetting her. And she said she actually, she understands that the nurses, we have nurses different of male and female, but she wanted to feel more comfortable if if we would have a room full of female, because of her, because how she has grown up, and that will make it very easy for her, since she has canceled her procedure twice before, because of the same reason, but now she had no option. So at that time, we have started a new initiative in the endoscopy unit called 2 Women by Women, where all the patients, where we have a full team of female, respecting their, first understanding the cultural needs, understanding the cultural sensitivity in the region itself, and then providing patients with a setting where they feel comfortable and respected.
Wonderful.
And were there any challenges and barriers to implementing that project?
It wasn't easy for having cultural diversity team to understand what is the rationale behind what we're doing, because where they came from, it used to be okay to be taken care by different genders, but then we're not implementing this for all the population. We're implementing for specific people who really would like to have a complete female team from the beginning till the end, which they actually, that will help them that will support their health and empower them to come for their procedures.
And I think when you're truly putting the patient's best interests at the centre of all your decision making, you've demonstrated that it was worth investing and engaging everybody into this program for our patients that need this service. So congratulations, I think it's wonderful. I've seen it in action, and I've seen many, many happy women who get a Women for Women team for their endoscopy, and it's a very private thing to come for colonoscopy. So when you can come and trust us to take care of you, that's something lovely. Also, Alia, I'm just so impressed with how you manage a very busy and big unit. You have, I always think a manager's role in a hospital is the most pressure and expectations on. You have to run the business, you have a great deal of quality metrics that you have to achieve, keep the team engaged, a busy throughput. Have you got any advice for others that might be aspiring to a leadership position like yours?
I would say be the leader that you have always wished to be. Seek out mentors that they will help to guide you along the way, and also never hesitate to take any opportunities that will help you grow in your leadership position.
It's great advice.
Yeah, that is. Yeah. And in particular, is there any sort of opportunities people should take early to do a stepwise approach?
For being a leader. Most important, start with networking, and most important, once you network, you can find best fit mentor for you that can help you understand the whole situation, talk about it, be open, be transparent with your team, and listen from them, listen to their feedback, accept feedback. These things I can say.
That's fantastic.
I think nursing has, we talk a lot about the resilience and ask a lot of our nurses. And, you can always tell as a leader when the day is going really well or the day isn't going so well. What's worked for you as a nurse manager of your area when maybe the day hasn't gone so well? How do you help your team with wellness? How do you help your team with engagement and essentially maybe help them reset so they're ready for the next day?
So first I can say that, I have a very engaged team, but still, we have to ensure that they're always engaged. We have a social committee, they have created social committee in the team where they connect with the team, ask them if there's any activities in between, if there's any activities they would like to be engaged of, whether it's inside the hospital, outside, the hospital itself provided Layaka program, wellness program, EAP, EAP programs as well, that will help them, that will provide psychological support as well. There's actually a lot of resources in the hospital itself, but also as a manager, it's very important, this is what I learned from Joanne, that we need to round on the staff, on the team, go every time at least for 10 minutes. If you cannot do it in a day, we have to do it at least in a week. Listen to the team. It's very important. They have very important inputs. And also at the end, there's an opportunity to ask them what will make you engaged, and if there is any celebration, opportunities, or anybody they would like to recommend or celebrate, and go back to the huddle in the morning, and mention these stuffs. There's somebody appreciating you for what you have done yesterday or a day before, and that at least how they start the day. They start the day motivated, listening to these positive, positive words.
That's great. That visibility and words of encouragement, so simple, but yet so powerful.
And having the team feel heard, how important that is to connect to the individuals. I have another question. Again, a very important part of what you're doing is building a team that's sustainable for the future, and it doesn't happen by accident. It's many small steps that you do on a constant basis, and I've worked closely with Alia, so I know how much she puts into this. But can you tell us a little bit about what you think is great for succession planning? What does that mean, and how do you try to achieve that within your team?
So, I'm very appreciative that I'm one of the people who've been getting the succession planning from my director, and most important that everyone is approachable here. I can go to Darren, I can go to Joanne if I have any questions that that can help me to develop to develop myself in leadership. So the whole thing helped me to also bring the succession planning to the team. I have my assistant nurse manager, which for now I can tell you that 100% that she's ready to step when I'm not there, when I'm not in the unit. Most important, when I'm on leave, I know that the unit is function. They don't have to. They might need some guidance, but they're 100% ready. It's the same, helping her to do the same for the charge nurses. Learning the art of delegation itself. It's delegation wasn't it's not just giving work. It's also the patience. The patient that comes with delegation. That's why we call it art, because we can do the things if we want something, we can do it. But then having the patient, making sure that this person knows that they can come back, ask questions, help them through the way. It will take time, but at the end, they are ready to do the task that you wanted them to do.
And I can say that your team certainly are like that. Even your shift leads can handle anything, and your charge nurse. So well done, congratulations. It's not easy. And then Beth, do you have another question?
I don't have any further questions. I just can't thank you enough for sharing what it's like to be a nurse here at Cleveland Clinic Abu Dhabi, and one of our UAE nurses and nurse leaders. I think that we really want the profession of nursing to continue to be recognized and grow here, not only within our four walls, but within the country. And you just set a great example with your integrity, compassion, accountability, and positivity. And I just can't thank you for sharing that and being vulnerable and answering all of our questions. And Joanne, I enjoy working with Joanne. She's, as you said, a great mentor. She's a mentor to me. And thank you for leading your areas and for mentoring Alia. Your work continues to just be, you're leaving your breadcrumbs along the way.
Well, thank you. It's the very thing that is motivating and inspiring is when you make those connections and you feel you can help somebody. So I think that's why we all became nurses in the first place. We just want to help people.
That's right.
So, yeah.
Well, we hope that you enjoyed our podcast today, Nurse to Nurse, Bedside to Breakthrough, and we look forward to you listening in on the next podcast. And please know that we have a great team here, and look forward to future podcasts. Thank you.